Hey everyone, it's Talia Tee, and I am a third-year optometry student. And in this video, I just go through my normal everyday routine. You know, going to clinic, going to lectures, studying, all that fun stuff. So you guys can just follow me around. So it's currently 7 something in the morning. I have class at 7:30. So right now I'm just getting my stuff together. So normally we have class in the morning, and then 2 days out of the week we will go from class to lab, and then another 2 days out of the week we go from class to clinic, and then 1 day out of the week we go just to class. So like Mondays and Thursdays I have 2 classes in the morning, or a class in the morning, and then I have lab. And then on Tuesdays and Wednesdays I have 1 or 2 classes in the morning, and then I have, well, 2 classes on Tuesdays and Thursdays. So on Tuesdays and Thursdays I have 2 classes in the morning, and then I go into clinic. From 7:30 to 9:30 I had class. I had 2 separate classes. I had one class from 7:30 to 8:30, which is vision therapy, and then another class from 8:30 until 9:30, which was case analysis. And then after those classes, usually I would have clinic from 9:45. On Wednesdays, usually I would have clinic from 9:45 until 11:45, or until that patient appointment is over. Unfortunately, I didn't have a patient today, but I will include footage of how I set up and prepare for patients from what I recorded yesterday. I also can't record patient encounters because of HIPAA, so you only get to really just see me setting up and how I prepare and the equipment that I use during the exam. That's all you'll be able to see. So I'll put that in now. So the very first thing you see when you walk into the exam room is the slit lamp TV, which helps people see, as well as the teaching tube, which isn't in this room, the phoropter I just showed you, the exam chair, some of my own personal equipment, and the good old eye chart. The very first thing that I do every time I walk into my exam rooms is clean off all the equipment and reset it back to 0, just so that all the equipment will be ready to go for the next patient. And then I'll go on to our charting system, and I'll look to see if any patients have arrived. And if no patients have arrived, I'll look at the established patient charts and see what they're coming in for. And then I go back to the equipment. Here I'm just double checking to make sure that all the dials and levers are working, because there have been many times where it decided not to work, and that is pretty embarrassing. So I'm just double checking everything and resetting all that equipment again. So normally I would see 4 patients on a Tuesday, and then I'll see 1 patient on Wednesday. However, the preceptor for my clinic group was not here today, which is Wednesday, so I don't have that 9:45 appointment that I normally would have. So instead what we did was we went to go do some OCTs for this assignment that we had. So for one of our classes, it's called posterior segment pathology, we are required to do certain specialty testing and imaging at the school. And I did my last one for that assignment today. Same.
Like, very
I'm like going like one hand up.
I literally just finished like the old material.
I just finished the assignments.
Have you seen a little green dot? I want you to look at that green dot.
I don't see it. No, there's like lined up.
Oh yeah, let me line up your people. Go ahead and go in there first. It's gonna come to you now. See it? Okay, so look right at that green dot. I'm gonna do your mouth about this. And let's see what happens. Follow the green dot. Okay. Good. Now blink a couple times and hold it open for just a second. Hold on a second. I just want to be in the center. And blink, and hold it open. Okay. Woohoo! You did it. Although up here it's a little cut off, so my signal strength is good. Look at your beautiful eye. You have a very healthy looking eye. Look how like deep that is on the nasal side. Wow, yeah, you got a thick choroid. All the white choroids want your choroid. That's a good signal strength too.
Yeah, see here, there's a lot of crossing on it.
Probably blood vessels here.
Probably.
And then this has got to be like your RPE, your inner outer segment, all that stuff. Here's your choroid. Let's see if we can grayscale. There. That looks so good. It looks like textbook choroid. Let's see, what's
This is the NFL, right?
yeah.
Because it's more prominent nasally.
And it's always, more prominent nasally. And then your blood vessels are really like evident here. Like the shadows of your vessels. I think that's what that is.
Yeah, I think so.
I don't see one thing
Which
wrong
makes
with
sense
this.
because we were saying like it crosses so much
Yeah.
into the macular area. Okay, so now I have my coat all nice and dirty from the week, and usually what I'll do is, since I only have clinic on Tuesdays and Wednesdays, I'll go and wash my coat Wednesdays after clinic. But as I said, I have sports vision today, so I'm going to be changing, so I'm going to go ahead and put it into the wash now. And I'll look up my lecture notes or whatever, and then I'll study from that. So I needed to look up the specific one. I'm looking it up right now, and then as I'm ironing my clothes for sports vision, I'm gonna watch that video. All right, so now I'm all ready for sports vision. As I said, it's just like track pants and sneakers, and then a school t-shirt as well. Now I'm just studying and preparing for a quiz that I have on Friday, and then I'm supposed to go to sports vision at 1 o'clock. I'm gonna head up there around 12:30, but it officially starts at 1.
Essentially, and then there's mid-peripheral thickening.
So it's double, both sides.
I'm gonna go up a little bit, and then you can go through the practice, and that's
So I am so sorry, guys. I did not know my tag was sticking out this entire time. I just noticed as I'm editing the video. I hope it's not too distracting, but this
the
is my
practice.
life.
You can tell us if you want to go up or higher.
Okay.
So
Yeah,
don't stop.
looks fine.
And if you want, you can take 2 fingers and swipe down once. There you go.
It's like third time's a charm.
Simple.
Okay. Weird. I always think I'm like touching the circle. I'm like in the rolling area.
Push harder. I was like shaking the TV.
Oh, you were?
Yeah.
Yeah, you're not gonna hurt it. You don't have to be gentle with it.
And I was using like 2 fingers. Go, 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 go.
I've been
Make sure you're
pressing.
touching at the center. That's where
Oh, okay.
It's so stressful. Okay, good
you
luck.
get in trouble.
As Dr. Chin said to me, that was just the practice.
Yep, yep.
I didn't
It's your
get it.
warm up, you know? That's all it is.
Oh, you got one.
Come.
There's like an arcade game like this at Main Event.
Whack-a-mole. It's called whack-a-mole.
Oh, there's one with lights too. Where you have to like.
Stop talking. Focus.
She's loading herself.
Okay, got another one.
I just need to get 2. I feel.
Yeah,
I feel satisfied.
I got 3.
Go.
4. Yeah, I did better when I stopped talking. So I just got back from Sports Vision. I didn't record everything basically because we did a lot of different tests throughout a whole 2-hour period. There weren't any patients or athletes coming in during that 1 to 3 o'clock time slot that I was there for my rotations. So since it was our first time, we really just got to play on all the devices ourselves. So I'll just put pictures pretty much of what kind of the things that we use for Sports Vision. We use this thing called the rock string, which helps you work on your ability to converge and diverge your eyes. All the tests that I'm telling you, they have different manipulations and alterations that can make it more customized to that person and that athlete based on their sport or whatever they're doing, so that you can make sure that they're improving in that specific skill set that you want them to do. So other things that were done were a whole evaluation of the skills. It evaluates different features of your vision skill set. So get your visual acuity, depth perception, ability to your hand-eye coordination, things like that. So different skill sets visually, and it assesses those and gives you your score based on normals for that sport and that level of that sport. I mean, this is something that was apparently created by Nike, and then it was taken over by the new brand. And then over here, we're gonna have basically this machine where you have to hit the circles similar to what you've seen in the video, but this is more customizable, and you can choose like what areas you want the circles to be. Apparently I did really terrible in my lower left area. So yeah, so now what I'm going to do is I'm going to snack and study. I hope you guys enjoyed the video. If you have any questions for me, my email address is taliatunstill95@gmail.com. I also have an Instagram, talia.tee, and you can also watch my YouTube channel, which is Talia Tee. Thank you guys for watching.